Everyone, welcome to GrowMed. In this video, we will see certain one-line questions from the psychiatry subject, which were asked in the Fmge in the past years. As psychiatry is a very short subject, and 5 to 6 questions, sometimes 7 questions are asked from the psychiatry. So if you do not have time to cover the whole syllabus, whole psychiatry subject, because now it's high time and you just need to revise it. So looking at these points, you will be able to solve the psychiatry questions, and this video is like a revision. So by looking at this video, you will be able to recall the most of the points and also will be able to solve the questions. So from the psychiatry, usually one line questions are only asked maximum, but 1 or 2 case-based questions if they ask, you'll be able to solve it that also if you look at the each points and understand it. So let's begin. Lithium is contraindicated in pregnancy because it causes Epstein anomaly, which is a tricuspid valve malformation. Okay, so it is a cardiac defect, and the lithium, it is a mood stabilizer and used in the treatment of the bipolar disorder and the mania. So these are also some important points which you need to remember from the lithium. And along with that, there are certain other side effects of the lithium, like the thyroid hypothyroidism and the tremors is the earliest. So these were certain important one-liners which were asked from the lithium. Then moving on to the next question, that is the electrocomplexa and the oipidus complex. These complexes are seen in the phallic phase. Then the next question, the key feature of the depression, asked multiple times this question, and the answer is the low mood. So the next question, the Capgras syndrome, it is associated with the Lewy body dementia. So it is also a very important topic, the Capgras syndrome, and the questions are asked even on the definition of this Capgras syndrome, and it is the a familiar person is replaced by an imposter. Okay, so the patient believes that a familiar person is replaced by a stranger, so that syndrome is called as a Capgras syndrome. Then visual hallucinations, these are seen in the organic mental disorder, and the auditory hallucinations are seen in the functional mental disorder. So the brain lesions, they are broadly classified into the organic mental disorder and the functional mental disorder. Organic means there is a trauma to the brain or insult to the brain. There are changes in the anatomy of the brain, and functional means there is no trauma and the defect is in the functioning of the brain. So with the organic mental disorder, features like dementia, delirium, loss of consciousness, these kind of things are seen, and with the functional mental disorder there will be delusions and hallucination. Then moving on to another very important topic, that is the insight. Insight is the awareness of the one's state of the mind, and it is absent in psychosis. The drug of choice for the schizophrenia, it is the olanzapine. And if the question is asked for the resistant schizophrenia, then the answer will be the clozapine. So schizophrenia also a very important topic. Questions are asked on the schizophrenia, the types and the treatment. Okay, so the next schizophrenia with the best prognosis. The catatonic type of the schizophrenia has the best prognosis. Catatonic means there will be involvement, motor involvement in this. Then the next question, the most organic disorder, it is the delirium. Then schizophrenia with worst prognosis, it is the hephrenic type. The hephrenic type shows the worst prognosis. And the most common type of the schizophrenia, it is the paranoid type. And this paranoid also has a good prognosis. Okay. Then moving on, the most common side effect of the lithium, as we have discussed here, the lithium side effect, tremors. So the most common and the most early is the tremors. And what kind of tremors are seen? These are fine and the coarse tremors. The most common cause of impotency in the male, psychogenic. Then excessive sexual desire in the males. This condition is called as the cytiriasm, and if the same condition is seen in the female, the excessive sexual desire in the females, it is called as the nymphomania. The sleep spindles and the K complexes are seen in these are seen in the non-rapid eye movement stage 2 of the sleep cycle. So you need to also read the sleep cycle and the waves and which in which stage which waves are seen. Then moving on to the next question, the maximum metabolic side effect is seen with, and it is the clozapine. So it is an atypical antipsychotic which is used for the treatment of the schizophrenia, and it has a maximum metabolic side effects like there will be increase in the uric acid levels, then increase glucose, then mini mental status examination. It is used to see the concentration of the patient. The patient is asked to minus 7 from the 100 serial uh, subtraction of the 7 from the 100 to know the concentration. Then the most common psychiatric disorder, it is the anxiety. So anxiety is the most common psychiatric disorder which is seen, and the most common complication of the OCD, it is the depression. Then the delusion of grandiosity, this is seen in a mania patient, and the delusion of desire, it is seen in the schizophrenia patient. That means the ideas of the patient will be very desire, like he will think that if I urinate, then the whole world will sink. So this was an example of the desire delusion. Then moving on to the next, the teratogenic effect of the valproate. Valproate is also a teratogenic drug, and it is a mood stabilizer which is used in the BPD and the mania bipolar disorder. And the teratogenic effect is the neural tube defect. That's why it is avoided in the pregnant females. The squeeze technique is used in the premature ejaculation. Drug of choice for the Alzheimer's disease, it is the donepezil. And the drug of choice for the OCD, fluvoxetine, asked multiple times, a very important topic, OCD. And also questions are asked to make the diagnosis, like a person is continuously washing his hand, so which kind of disorder is seen in him. Then the treatment modality for the phobia, it is the behavioral therapy. And also another very important question, that persistent depressive disorder, it is this or depression along with the dysthymia. So depression along with the dysthymia, this condition is called as a persistent depressive disorder, and it is a mild form of the depression, but it is long standing. So that's all in this video, guys. So this was a list of a certain important one-line questions which were asked in the previous years. That's all in this video, guys. I hope you find this video useful. Like the video, share it with your friends, and subscribe to my channel for more such useful videos regarding the FMGE. And all the best for your exam, guys. Thank you. Bye bye.